Hospitals is one of the largest hospital trusts in the country, employing over 16,000 people. First of all, thank you very much for coming in, Richard.
Good afternoon. Thank you so much for having me on your show.
Excellent. Thank you very much, Richard. Ramzan is we're on day 3 of Ramadan here. Lots of people are fasting. Lots of people, I'm sure, in the hospitals are fasting. Have you done a message to the staff, and what have you been doing over the last few days?
We have, yes. So I'm delighted to be on your show. Thank you for having me. Just a little bit about myself, first of all.
Yep.
So my family and I, we've lived in Leicester and Leicestershire for 9 years now. My children go to school in the city. My children were born in the Leicester General. As you were describing, the University Hospitals Leicester is a massive employer. We employ over 17,000 people, and maybe in a moment we can talk about some of the jobs that we're actively looking to recruit. One of the things, I'm from London. I was born in southeast London, so I grew up in Lewisham and New Cross. I grew up in an area that was incredibly had a vast array of ethnic communities there, and one of the things that really interests me and motivates me about working in Leicester and Leicestershire is the communities that we serve. I would like to wish all of our listeners a happy Ramadan. I wrote out to the organisation on Friday acknowledging this. I wrote out about the steps that we can take to be a good employer and to also be thinking about our patients and our communities during Ramadan for the reasons that you've described.
Excellent, thank you very much. I mean, I have been to the hospitals recently. I had to go in to there quite a bit a few weeks ago, and I was really impressed with the multicultural room, the prayer facilities that have been provided. Lots of staff during the day when they're on their breaks go and do their prayers, and I just wanted to say thank you for that facility that you've managed to achieve there, and so well used as well, especially at the Royal.
Yeah, absolutely. So one of the things I've been back. Again, let me rewind slightly. So my family and I moved up from London in 2013. I worked here for 4 years between 2013 and 17. We stayed in the county, but I was commuting up to Nottinghamshire, and I've been delighted to be back working in University Hospitals of Leicester for 6 months now. Our workforce is incredibly diverse. We obviously serve the city where there's over 70 different languages spoken. You all know better than I do, but Narborough Road, I think there's 29 different nationalities there within the space of a mile. It's an incredible city. There's a huge diversity, and what we really want to do is to be a good employer for all, and we want to be a good provider of care to all. And whether that is through different ethnicity, different religions, different faiths, we want to acknowledge the different needs of our colleagues here and to make sure that everyone feels included. I'm not trying to convince you or your listeners that we're in that place at the moment, but I believe we're on a really exciting journey to make a big difference for a vast number of people.
Excellent. Richard, you're probably one of the youngest and newest. You've only been in the post a few months.
Yeah.
Youngest chief execs in the country. You've taken on a huge role. This is one of the largest in the country, and I think if I'm not mistaken, it's the largest A&E department in the country as well. It's a massive task for you to turn around.
It is a huge task. So I'm happy to declare my age. I'm 41 years old. I was fortunate to be made chief exec when I was 36 up in Nottinghamshire. It is a big task, but I think it's an honour. One of the things that motivated my parents in their public service career and motivates me is wanting to make a difference. Given that Leicester is a ginormous employer, we provide care to over 1 million patients a year. What an opportunity to make a difference. The way I view my job is trying to work with others around me to try and improve the care to our patients and trying to improve the employment opportunities for people who work here. You are right. The Leicester Royal, we had 832 patients through our doors yesterday. There would be nowhere near that in the country. It's ginormous. We would have provided outpatients to many thousands of patients. The Leicester General, I'm sure we'll come on to that, is incredibly important, as is the Glenfield. So I feel a real sense of responsibility in a positive way to make a difference for the people who choose to work at UHL and receive their care. And I would be the first to acknowledge that things are far from perfect. That is not because the people at UHL aren't working hard. They're working exceptionally hard with GPs, with Leicester Partnership Trust, working with the local government and others. But I think the way of working that we're trying to evolve will make a huge difference over a prolonged period of time.
Thank you. You're listening to Radio Ramadan on 87.7 FM. I'm your host, Zuffar Hack. Please get in contact with us. Our telephone number, if you want to call in and ask any questions, is 0116 248 2206, or you can send us a WhatsApp or text message on 07748 855 055. You're listening to Zuffar Hack, and we've got Richard Mitchell, the Chief Executive of Leicester Hospitals, in with us at the moment, talking to us about the hospital. Richard, how busy are our hospitals at this moment in time?
Very busy. I'm trying to think of a more precise way of answering. The public service is very busy. All forms of public service. Our hospitals are busy. To try and provide a bit of context to it, so we have circa 2,000 beds. We have about 220 patients with COVID at the moment.
Is that COVID as their first illness or their second illness?
No, it's a really good question. Thank you. So we have 220 patients with COVID, of which 85% of them have COVID as a secondary diagnosis. So the vast majority of patients presented with something else. That I believe is evidence that the vaccination program is working. We would still urge people, irrespective of age, irrespective of demographic, ethnicity, to have the vaccine. It's a very safe way of protecting you and protecting others. But we have circa 1/10 of our beds have patients with COVID at the moment. For the last couple of weeks, we've had no patients with COVID in intensive care, which is positive news. We've currently got about 8%, so 1 in 12 colleagues are absent from work at the moment, just linked into COVID and other winter pressures. But as I say, our emergency care department, 830 patients through the door. We have a full programme of planned care, whether that's outpatients or day case or inpatients, and we've also got a very busy cancer and diagnostics programme. So the hospitals are busy. I think we are coping, but we are only coping because of the incredible effort from the people who work at UHL and our partner and our support organisations. Normally this time of year we have exited winter, we're in spring, moving into summer. It is a slightly easier time of year. It does not feel easy this year.
Yeah. I mean, you mentioned that there's 85% of those patients are secondary COVID first. So vaccinations are making a huge impact in improving that scenario, so stopping people from going to hospital. But that has a huge knock-on effect to the rest of the services you provide. I mean, I'm speaking to lots of people saying, we're waiting for our operation. They're having to wait for a hip operation or a knee or regular kind of stuff. And is that backlog getting any better? And, what can we do to try and help the hospital?
Yeah, so undoubtedly patients are waiting far longer than we would want for their care, in particular their elective care. To try and provide some examples of this, so if we rewound 2 years ago, across the NHS there would have been less than 1,000 patients waiting a year for surgery. At Leicester hospitals, we now have patients waiting 2 years for surgery, and I'm so sorry to those patients, their friends and their family. I have a mum in London who's waiting for surgery at the moment. I know at first hand, and I talk to patients, I know at first hand the impact that it can have on people. So we've got patients waiting far longer than we would want. More positively, over the last 6 months, we've been able to take a series of steps to reduce the waiting times for our longest waiting patients. So, for example, on the 14th of January, at the Leicester General Hospital, we were able to, the phrase we use is ring fence, we were able to ensure that our orthopaedic beds there, so things like hip surgery, knee surgery, ankle surgery, etc., they were protected for orthopaedic patients. We can now evidence that over the last couple of months, the waiting times, the longest waiting times for orthopaedics has dropped dramatically. We now need to ensure that we're doing that for all of our specialties. But the real challenge we have is, going back to my point about 2,000 beds, we are a large organisation, but we are caring for emergency care patients, for cancer patients, for elective patients, and we've also got the impact of COVID, and it is very problematic within the bed base that we have to be caring for all of our patients in a timely way. The waiting times are reducing, but we have a huge amount of work to do to get them back to the level they were at pre-COVID, and that is not good enough. We want to be, going back to my opening point, we want Leicester Hospitals to be the best possible employer and the best possible place to receive care, and that's the mission that myself and my colleagues are focused on delivering.
Lots of staff who have been working over the last 2 years at the hospitals, which I speak to quite regularly, lots of them say, we're tired now and we are exhausted. What is the hospital trust doing to support them, and what can the public out there do to try and support them? I know during COVID there was lots of people delivering pizzas and water and lots of other things, hand creams and scrubs. So lots of community effort out there. But what can the public out there do to help as well?
Well, just on that point, if I just wanted to acknowledge personally the huge difference that you, Zuffar, have made to our local hospital. I'm very grateful for that. You and I and one of our non-execs were in the hospital on Christmas Day?
Christmas Day,
Christmas Day, and you'd organised a whole series of gifts for colleagues. So thank you, not only for what you've done over the last couple of months, but I know you're a massive advocate for University Hospital of Leicester, and we're very grateful for that. Thank you. In terms of how do people feel at work, I think, as we say, we employ 17,000 people at UHL. These are members of our community. Many of them live in the city. There will be people from UHL listening into this. We will all know someone who works in the hospital. COVID has ripped through our working and our personal lives. I don't think anyone is living their best life at the moment. There's obviously a whole spectrum of how people feel, but I think in general, some of the words that use, people are worn out, people are tired. I think some people are lacking in hope and optimism. What are we doing at UHL to try and look after people? Each year the NHS does a staff survey. The results for 2021 were published on Wednesday last week. We have a huge amount of work to do to make sure that UHL is a better employer for people. What we've publicised within the organisation is we're focusing on 12 key things to make people's working life better. For example, they are things like ensuring that we can provide safe car parking for people, ensuring that the quality of our food provision is better and that it is better value, ensuring that we're able to protect people's breaks and annual leave, ensuring that it is easier to recruit people and to retain people. So we're focusing on 12 basic things that have been generated by what people in the organisation have told us about their experiences. The organisation I worked in previously in Nottinghamshire, we went from pretty humble beginnings to, in 2021, it was voted the second best place in the country to work. That's where we will get Leicester to. In terms of what can the wider communities do for people who work at UHL, I think it's receptive to that you've got people working in the public service, like in the private sector, but working in the public service, who are incredibly tired at the moment. And going back to the bit about vaccinations, I think it is personal choice, but I think choosing to have the vaccine continues to be a very wise decision. And I would continue to ask people, when you are in one of our hospitals, please wear a face mask, please sanitise your hands. Whenever possible, please maintain social distancing. It's the best way of protecting yourself and others, and I think it's a good marker of respect for the people who work in the NHS.
Excellent, thank you very much. Leicester's hospitals, the three sites, the General, the Glenfield, the Royal Infirmary, you are effectively the largest employer of any organisation in Leicestershire. You are the largest employer. You have so many staff working for you, so many different people. That, it's not just about doctors and nurses. It's all the support staff behind the scenes who have all worked so incredibly hard over the last 2 years. And you pick that up when you're going out and talking to people. How do you feel when you meet some of those people that have been working so non-stop?
So, as the chief executive of the organisation, I feel hugely honoured and privileged to be part of the team. I am humbled by how much our colleagues have given over such a prolonged period of time. As you quite rightly described, in the NHS, we quite often think about the doctors and the nurses and the midwives, and they are key colleagues. But at UHL, like in any hospital or any healthcare setting, it's all based around teamwork. High quality healthcare is based around the combination of people coming together. And I know, speaking regularly, I speak or listen most days to the doctors in the emergency department, nurses there, our midwives and beyond. They will be the first to say they cannot do their job without the porter, without the domestic, without the colleague who works in finance or HR, or the person who's serving the teas and coffees downstairs. And I was checking earlier today, so we employ 17,000 people. We've got in excess of 200, we've got way more than 250 vacancies, but we've got 250 individual jobs advertised at the moment on something called NHS Jobs. One of the things that we are really trying to do, and we need to do it in a more effective way, is to engage with the communities and say, not all of us would want to be a doctor, not all of us could be a doctor, but irrespective of your skill set, of your experience, I can guarantee to people listening to this phone in, there is a job for you at University Hospitals Leicester. We want to move beyond using something called NHS jobs, but if you were to go on NHS jobs and just search for Leicester, there are many, many jobs ranging from as I say, from the porters, from the domestics, from the administrator, from the front of house office, to a doctor, to a nurse, to everything. We want to be the best possible organisation to receive care, and one of the key enablers of that is engaging in a more effective way with our communities in the city.
Yeah, so you might not have a degree in medicine, or you might not have any, even a GCSE in biology, but you can actually get a job in the hospital as a clerical assistant, or there's quite a wide range of jobs, and mostly, NHS, the pensions are fantastic as well at the end of it, isn't it?
Yeah, they are. So I think there's a very wide range of jobs. I think there's a job for everybody. I think there's a security within the NHS that there aren't in many jobs at the moment. We know, unfortunately, one of the impacts on COVID is many people were furloughed or been made redundant or have lost their jobs. The NHS is an organisation that will be here to stay for certainly all of our lifetimes, and irrespective of your background. So I haven't got a degree in medicine. I got a very low mark for GCSE biology, and I joined the NHS in 2003. As an admin assistant, I was known as a notes prepper. When you go into to a clinic and you see a doctor or a nurse, at the moment they've got notes in front of you. My job 20 years ago was prepping those notes, printing the pieces of information off and putting it in a file. There is a job for everybody.
There's a job for everybody, and the opportunity is there to actually go along the system and actually get to the top.
I think so. Yeah, I think through a combination of luck and hard work, I was fortunate to be in the job that I'm in. But one of the things we want to do is to establish, as I say, there are jobs for everybody, irrespective of your experience. We do want people. I think what is important is people's value set and beliefs. We want people who can truly identify with the importance of kindness and compassion and want to look after other people, who value the importance of teamwork. I think humility is a really important quality. But I think if your listeners feel that they've got a combination of those, irrespective of their academic attainment, there's a role for you at UHL. And I personally think, given the size of UHL and where the organisation is heading, we can offer people a really interesting and successful career. And as you did say, the NHS pension scheme compares very, very well to other pensions.
And it's a very, very rewarding job. People must be proud if they say, "Oh, well, I work at the hospitals." I go, "Wow!" I actually think that, because they are saving people's lives. They are part of that system. The NHS is a fantastic organisation, and you don't realise until you look at other systems across the world. And I've had the opportunity to do that, and you just think, the NHS is something really, really special, and I think people are beginning to realise that, particularly after the COVID pandemic.
Just on that point, my mate, I recognise we don't always get things right. As I say, it's not because of a lack of hard work from people. People are working exceptionally hard, but I know that we don't always get things right. I know that there are patients waiting for their elective care, for their surgery at the moment, longer than we would want. I'm acutely aware that we've got patients waiting in A&E for longer than we would want. But what we have got is unbelievable people, and I think they are doing a great job. And talking to the doctors and the nurses, and the midwives and the allied health professionals and the porters and the domestics, I think they get a real sense of, I hope that they get a real sense of personal reward for what they're doing, because they are amongst the best people in this world.
They really are. You're listening to Radio Ramadan on 87.7 FM. The telephone number is 0116 248 22206, or you can send us a text message on 07748 855 055. I'm talking to Richard Mitchell, who is the Chief Executive of Leicester Hospitals. Richard, one of the questions that I always feel, I was recently visited a hospital in Birmingham, the Queen Elizabeth Hospital, and I walked up to the front door. It's like it blew me away. It was so beautifully architected, so nice, so modern inside. It just shocked me to see such a beautiful hospital. And I think when I walk into Leicester's hospitals, I just feel, why have we lost out? Why has Leicester not got the state-of-the-art hospitals that many other cities have got around us, like Derby, like Coventry, like Birmingham?
That's a fair question. The three closest examples are the ones you described: Derby, Coventry, and Birmingham. What I would pull back is I'd pull back and try and provide some of the context. So there are many hospitals in the NHS, or many hospital trusts, including Leicester, that need investment in buildings and equipment. The good news is University Hospitals of Leicester, along with 7 other organisations, are right at the top of the tree for investment. I think it was well publicised a couple of years ago, and I was in a meeting earlier today about the plans for our hospital builds. So we are intensive care is a key enabler for the movement of services. Intensive care is changing in a month's time. We are committed to investing in our maternity services. We are committed to investing in a standalone children's hospital, and we're committed in taking steps to separate and strengthen our elective care and our emergency care pathways. It is taking longer than we would have envisaged a couple of years ago, but we are having all of the conversations with the people we need to be having, and I want the communities to hear. Possibly sooner rather than later, sooner than imagined, we will be able to get these ambitious and well understood hospital build programs off the ground. Leicester will have the hospitals that we need to have.
Excellent. We've just had a message. Somebody's asking, what was the website again for the jobs?
NHS jobs. Let me just check it.
If you just Google NHS jobs, it will come up.
It's NHS
jobs.
It
will come up, and if you then type in Leicester or Leicestershire, all the jobs available in Leicestershire come up. But keep an eye out, because those jobs change all the time, don't they? Almost daily.
It is. So it's jobs.nhs.uk. When you go onto the page, you've got 2 functions. You've got keywords, and the second function is location. So if you are looking for a porter job and you don't mind where you want to work, put under the keywords porter, and then porters across the country will come up. If you are more interested in a specific location, under location, type in Leicester, or you could even be more specific, Leicester General Hospital. There we go, popped up.
Excellent.
You can see there's got 31,000 jobs that are live. I'm just going to type in on my phone, Leicester.
And you know, when people go for a mortgage, when they see somebody who's working in the NHS, it's pretty safe for the banks and for buying property, because they look and they view the NHS as a very safe job, don't they?
Absolutely. So you can see there 305 jobs. I think when I checked earlier today, there was about 290 jobs. Plays back to your point, Zuffar, that it's updated all of the time. I think it's an easy to use website. You can see when the job went live. You can see when the job is closing. And yes, from a mortgage or from a rental perspective, the NHS is seen as a job for life.
Job for life, yeah. And look at the variety of the jobs there. Just reading down that list: estates management, admin staff, care coordinator, lots of different roles. So there's lots of opportunities for people to join the NHS and become part of the great organisation.
Absolutely. So what I can see is we've got a medical doctor here, we've got a project support officer, we've got an administrator, we've got administrator assistant, we've got a nurse, we've got someone in estates, we've got a housekeeper roles. There really is a job for everybody. And
they are now reasonably well paid in comparison to lots of other jobs in comparison currently, yeah, I would say.
I would say that I would say 2 things. There's the stability that you describe, and there's also comparatively they're well paid. What I wouldn't want anyone to misinterpret me saying is I think people who work in the NHS are really well off.
No.
One of the I was having a conversation today with one of my colleagues. I'm acutely aware whether people are in full-time employment, part-time employment, whether they work for the NHS or whether they do another job. Many people at the moment are struggling. People were struggling before COVID, and people certainly have been struggling since. And one of the key things that we want to do at University Hospitals of Leicester and it will take some time to establish this, but we want to move beyond just simply saying, you do your job and we pay you for that. I think being a good employer is far more than that. And if I just may, one of the things, just a little bit of a story, because this is where I want to take the Leicester hospitals. I was working in Nottinghamshire during COVID, and when COVID first hit us, we knew that because the hospitals in Nottinghamshire, like other hospitals, we were asked to reduce the patients in hospital. So we reduced the volume of patients in there waiting for an increase in COVID. As a response from that, we were unable to have lots of people doing overtime because there weren't the patients in the hospital. We know that people are reliant on overtime, and we know that we had people in my hospitals who were reliant on food banks. So one of the things that we put in place was hardship funds to support colleagues in the organisation who were on the lowest wages. And for me, that's going beyond just being a simple employer to being a really good employer.
We've just had a question coming in. How can Leicester teenagers, 17-year-old, get NHS experience? It's very hard due to their age. Is there work experience available? I know lots of doctors and nurses and teams do have work experience available.
Yeah, we've had to restrict Leicester hospitals, like all hospitals, have had to restrict work experience during COVID because we've had to limit the number of people coming into the organisation. But we have. I was chatting to somebody last week who's been getting working experience at Leicester hospitals. What I would urge, in fact, whether it is particularly this question or any question, my email address is Richard. RICHARD.Mitchell, MITCHELL at UHL-TR.NHS.UK, and I would urge anyone who's got an interest in work experience or anything else to contact me personally. If you contact me personally, you will get a personal response from me. My job is to try and make the working lives of people at UHL better. My job is to try and recruit and retain the best possible people. And my job is to work with colleagues to try and improve patient care. So please contact me with any queries that you may have.
Excellent. By the way, you said that Nottingham came second in the survey of staff.
Yes, Sherwood Forest.
Yeah, they came second. We're the Premiership winners here in Leicester. We want to come first. So that's your task for the next couple of years,
yes,
Richard. So we want to have you back on the radio in a couple of years' time saying we are number one, and we should be. Leicester needs to be the top. We've got a great, diverse community here. We want to make sure that reflects in the contribution we make to the hospitals as well.
I'm really pleased that you picked me up on that. I wasn't willing to declare that myself, but I'm very happy to sign up to what you've stated there. And I think just two things on that. I think we can make a huge improvement in how people experience UHL as a place to work within the next 3 to 4 years. But I don't want, second point, I don't want people saying, I'm here to 3 to 4 years and then I'm moving on. My family and I, we live in the county. My wife works in the city. I work in the city. Our children have been born here. Leicester is our home. We are here. All things going to plan for a very long time.
Excellent. That's what we want to hear. There's not just jobs at UHL, though, is there, for the NHS? There's lots of jobs in LPT, that's the Leicester Partnership Trust, lots of jobs in primary care at GP surgeries. So at this moment in time, the NHS is recruiting continuously.
Absolutely. So the NHS is recruiting. Again, the points we said, irrespective of your background, your experience, the grades that you got from school, whether it is Leicester Partnership Trust, whether it's GP practice, of which there's circa 250 of them across the city and the county, whether it's working for University Hospital of Leicester, and also a shout out to local government, so City Council, Rutland Council, County Council. The public sector is recruiting. We know that our population is ageing. We know that unfortunately there are huge health inequalities, that there's high levels of deprivation. We turn during times of crisis or difficulty. We turn towards the NHS and the public sector. The public sector is recruiting, and there are jobs for everybody.
Excellent. We're talking about the general. Lots of people, as you said, your family children were born at the General Hospital. Lots of people in this community have a personal attachment to the General because somebody's relative, some family member has been born at the General Hospital, particularly on the east side of Leicester and the south side of Leicester. So what are the plans for the General? Because there's all sorts of rumours, all sorts of things flying around. What are the actual plans for the General and why are they happening?
So I'll start with some positive news about the General that I'm not sure everyone will be aware of. We received confirmation last month that the University Hospitals of Leicester will be given £37 million to build an elective care hub.
Oh, fantastic.
Which is
absolutely fantastic news.
A dedicated facility free from emergency care patients to focus on what we would call high volume day case surgery. So there are things like eye surgery, ear, nose and throat, plastic surgery, and that will be housed at the Leicester General.
So and how many patients do you think that will actually see per year, treat? Millions, not millions, but hundreds of thousands.
Certainly tens of thousands. So we have 115,000 patients waiting for elective care at the moment at UHL, and the elective care hub at the Leicester General is the key enabler for driving down.
And that is something new, isn't it? Totally new.
That's totally new. It is totally new money. And it is going to be happening in the next 12 months. It will be a facility that if you go to the Leicester General by Christmas, you will see patients going in and out of. I think that's a really exciting plan.
Really, really good news that is, because that's very similar to what Nottingham has in their on their grounds at the Queen's Medical Centre, and it's something that I was thinking about only a few weeks ago. So you've done a fantastic job in making sure that happens, really.
Yeah, I'm really grateful for the people who have been involved in securing that money. And as you say, it is a similar facility to one at Queen's and elsewhere. And I think people have worked exceptionally hard during COVID. If we had that facility, patients would be waiting for a shorter period of time than they're waiting at the moment. So that is great news. We know that we have over at the Leicester General the Leicester Diabetes Centre with people like Professor Melanie Davies and Professor Kamlesh Kunti, and that again is another service that we really want to be focusing on.
So that won't change. The Diabetes Centre, which has hugely world-renowned reputation, and the clinicians and the research staff, the outpatients, everything on the Diabetes Centre stays the same at the General Hospital.
Everything at the Diabetes Centre is staying at the Leicester General Hospital, and then just the final thing I would offer is one of the things that many people will say, well, we knew this already before COVID, and we did know this. But one of the things that's been proven without doubt during COVID is the importance of taking steps to separate elective and emergency care. And I am committed to working with partners across healthcare and beyond to identify ways in the coming months and the coming years to separate our elective and emergency care. And I think the Leicester General has a huge opportunity for increasingly being a ring-fence elective care centre. What I would say is whether patients receive their care at the moment at the Leicester General, the Leicester Royal or the Leicester Glenford, all three of them are viable healthcare settings.
Okay, excellent. And the maternity unit that is there currently, that is due to be moved if this new money comes in to the Royal Infirmary. Can you explain that so that people understand the rationale, the reasons behind that? Because lots of people, as I said earlier, have got family members who were born at the General. They had a reasonably good experience, so they see it as something that's probably better than the Royal. What will happen at the Royal, and how will it all change?
Yeah, so as you described, both of our children were born at the Leicester General. Every time I go there, and I go there at least once a week, it brings back mixed memories, happy memories, and then for my poor wife, quite a difficult pregnancy. But the care at the Leicester General and the care at the Leicester Royal from a maternity perspective, we will all have seen, it is really good. We will have all have seen the very sad news from other hospitals, the Ockenden report, Shrewsbury and Telford and other hospitals, the sad care that mums and babies and families have received. The Leicester Royal, the Leicester General is not in that place. We don't always get it right. We do try and learn. We work with openness and transparency, but we are a safe maternity services. However, we know that there are very few hospital trusts in the country that would have two separate maternity services in the same city, and our obstetricians, so our doctors, our midwives, our clinicians involved in this are very clear that we can strengthen the safety of our services by bringing them together. And our plan remains to have a single maternity service at the Leicester Royal Infirmary site with all of the services around it that you could possibly want.
And that's a new building, a brand new state-of-the-art building for maternity services at the Royal Infirmary. So all patients will be registered at the Royal Infirmary. The advantage is all cover will be provided there. So lots more support for those patients who actually go to the maternity services there.
Absolutely. So I know that for people listening, so we're on Evington Road at the moment. I know that the Leicester General, as the crow flies, is closer than the Leicester Royal, but we will make it as easy as possible for all communities to access that service. And as you say, it will be a purpose-built, state-of-the-art maternity service, children's hospital with all of the things that you could possibly imagine in there. So whilst it will be slightly further to travel, I think it is only slightly further to travel, I really think it strengthens the safety of the services we're providing. I don't want anyone to think, though, at the moment I'm saying our services are unsafe, because they're not.
No. I mean, I speak to lots of doctors. In fact, one of my next door neighbours works at the hospitals there, and they say, look, once we have this, there has been several reports over the last 20 odd years at Leicester that we need a new maternity unit. The current one that's at the Royal Infirmary was made for 8,000 births, and it's more like 12,000 currently at the moment. So that is required. The money is coming in, I assume, and then once that's done, that will change the way it looks for lots of people, because the actual quality of the care will be a lot better, in the sense that there'll be a lot more staff available there.
I think so. So I think if you think about what are the things that are required for high performing safe healthcare, you need a dedicated workforce. You need a talented workforce. Well, we've already heard, and your listeners know as well as you and I do, that the people who work at UHL and at LPT and in primary care are amongst the best in the country. So we've got a great workforce. We are actively continuing to recruit people, and we want to support the people in the organisation by having additional people joining. But healthcare is based around teamwork, number one. Secondly, you need a stable executive and senior leadership team. I've rejoined the organisation. I'm here for the long term. I think we have got an incredible group of senior leaders in the organisation. We've got a new chief nurse coming in. We've got some other senior leaders joining the organisation that will support it, and I think offer a very different and positive way of working. The other thing that you need two other things. You need an organisation that is embedded in its communities and working actively with its communities. And I know that we've done that in the past. I also know that quite rightly, and I understand that we've been criticised for the way that we've engaged. I would hope that the work of Bally, one of our non-execs, myself and others, is evidence that we are really trying to learn from the past, and we're trying to open ourselves up and be a more effective partner and an ally of our communities. And then the final bit is you need the best possible equipment and best possible buildings, and we're well on the way to securing that.
And that will help your recruitment, won't it? It will really help. If you've got a new build and all the facilities are there, staff are always happy to go and work there.
Yeah, absolutely. So you referenced Queen Elizabeth Hospitals in Birmingham, where I was working up in Mansfield. We were very fortunate that the building up there was great. And I think the building plus working with our communities in Mansfield and Newark and Sutton and Ashfield, looking after the colleagues who worked in the organisation, and having a stable leadership team played out really well. As you said, the organisation up there got to the second best in the country. We would hope and we would expect that University Hospitals of Leicester can be the best in the country.
And we will be, don't worry.
With your support.
The other question we have is, lots of people were talking about the fact that some of the general hospital site has been sold for housing. What is the rationale behind that? What is the reasons behind that? Is that enabling to fund some of the other development, or? Yeah,
this is the first question. I'm not entirely cited to it. I've seen some stuff in the media suggesting that land has been sold in the last 12 months. That's not the case. When I saw that reported a week or so ago, I checked that. So I have joined 6 months ago. I can categorically say in the last 12 months, land has not been sold. There was, I think, a small proportion of land or buildings was sold probably 18 to 24 months ago. And I think that is some working with the City Council around building houses. One of the things that we do have is a really effective, I believe, effective relationship with the City Council, and we are keen to continue with that. But the idea that we are selling land at the Leicester General at the moment is factually not true.
Okay, that's good. That clears up that issue. And how have you found your first 4 or 5 months in this job? You know, it must be very daunting, bringing in a new team, bringing in lots of different people. How have you found it?
It's been a real mix. I think on the good days and the good days are the majority of them. As I say, I feel the feeling that I had on the 4th of October when I came onto the Leicester Royal Infirmary site again was one of some nervousness, but ultimately I was excited, I was energised, and I felt really proud to be part of my local hospitals, and that feeling hasn't left me. The ability we have at Leicester Hospitals to make a difference for the 17,000 people who work there, for the 1.3 million people who use our organisation is incredible. It is a real honour to be part of the team. I'm also aware that we're not consistently providing the care that we would want to, and we're not consistently the employer that we would want to be, and that is a burden that sits heavily on my shoulders. I feel accountable, as you would expect in the organisation, for when things go wrong, but I'm dedicated to making a difference, to looking after the people who work on our organisations, who choose to work here in the best possible way, and by extension we are dedicated to being the best possible provider of healthcare that we can be, and I think many of the foundation stones for future success are in place.
Richard, it's a tough job you've got. It really is. And, I think, the actual relationship that you've got with your community, with your staff, is on a journey, and you're at the start of that journey. Please let us know, because, you've come along, we've invited you to come along to the show, to answer the questions. Please let the community know what they can do for you as well. Because there is 1.3 million people out there that you said that want to help you, want you to succeed. Yeah. And, Ramadan for us as Muslims is a time of giving, time of supporting, time of caring, time of sharing. And that's what it's supposed to be for us all year round, but particularly in Ramadan. So how can the communities help you? We know during COVID the hospitals had a tough time. There were lots of people supporting the hospitals. Whenever you need the community, please reach out and don't be scared to say, we need your help doing this. What are the, we want you to try and help us do this. Please try and reach out. Do you think you'll be able to do that in the next few years?
Yeah, absolutely. So I know there will be scepticism from people listening into this, or scepticism from people who have experienced UHL in the past, who just says this. Richard is a white man from London who's come up here to further his career, and he doesn't actually mean what he said. Well, you know a bit about me.
No, I know that's simply just not true.
No. I don't think it's true. But I would urge people to sort of to test my offer. I've circulated my email address. I was pausing for thought. I will do what I did on another radio station, Eva FM, with Balu. I'm happy to share appropriately my personal phone number, which is 077. Okay.
We won't do it on here, but
right, we'll put it up there.
We'll put it up there.
The point being, I'm here to help
You're here to answer the questions.
Yeah, and the point about the working with the community is, I think we want two things. I want people to test our resolve, to say, hang on, you've come on the show, you say you want to make things better. How can you help us with this? But I would also like people to engage with the organisation. So whether it is through employment, whether it is through support, hopefully we won't be back where we were with COVID before, but whether it's through that, whether it's through a range of other things, we want to work with people.
Richard, really been a pleasure. Thank you very much for coming on. And please thank all of the staff that work at Leicester Hospitals for their incredible job that they do. It is an incredible responsibility, but I know